Good afternoon, my name is Ethan Barr and I'm going to be the sports massage professional for a hamstring injury. Alright, so looking at what's happened to the injured person, he's had a hamstring strain, only a grade 1, which was a few weeks ago. So I've already looked at the hamstring and realised that there's no contraindications, there's no swelling, bruising, and there's hardly any pain. So what we're going to do is, he's just had an event and his leg's been alright, so we're going to do a post-event massage on the hamstring just to relieve any pain and aches that he's had from the event, not the injury. Alright, so I'm just going to get him to lay on his front. Yep, and it was the left leg.
Yeah, that's right.
So just roll it up. Alright, so since the hamstring is quite a large muscle, the first thing that I'm going to do is I'm going to use effleurage. Effleurage is long and hard strokes, getting right deep into the hamstring, obviously like seeing his pain levels as well. So noticing if he makes any grunts or sounds, then obviously I know that I'm going too hard, but obviously I have to put in a little bit of force just to get right deep into the muscles and the tissues. Using these long strokes towards the heart, up towards the heart, it helps increase the blood flow to the working muscles, to the muscle, which will remove the lactic acid and any waste products that have been produced through the event. I'm also going to do that for about 2 or 3 minutes. All the way through. I could also use any ointments or lotions if there isn't any grip, just to get a better feel of the hamstring and ensure that the strokes are smooth and long all the way through. This also introduces touch to the patient, so if he's uncomfortable and hasn't had sports massages regularly, it introduces touch and makes sure that he's comfortable in the situation and that he can relax. A psychological response also does the same thing. It helps the patient to relax after a hard or stressful event or game. It will help him to relax all his muscles and get into a calm state. Alright, the next one I'm going to do is friction. So after the effleurage, the blood flow has increased to the muscle and it's increased venous return. So now I can use friction, which is just creating heat throughout the muscle. Once again, also towards the heart, increasing that blood flow and helping to remove the waste products. I'll continue to do that for 2 or 3 minutes. Ensure that he's not hurt, there's no pain throughout the muscle. Alright, does that feel alright?
Yeah, feels good.
Alright, also just keep in mind that the table is a suitable height for me. It's round about my hip height, and then I'm going to stand with one foot in front of the other, making sure that I'm not bent over or putting any strain on my back or my legs, and just using my back foot, just going to push back, and I'm going to lean into it, using the bottom of my legs and my core strength to push into it. Also, I'm not going to stand like feet side on. I'm not going to use all the stress onto my arms and my shoulders, because if I get through like a few clients a day, that's going to be an hour or 2 hours each time, and it's going to put a lot of strain on my muscles and I'm going to get fatigued. So we're just using our legs and our core strength to just really push through and use our body weight to get through to the muscles. Yeah. Hi, my name is Ethan Barr. I'm going to be the sports massage professional today with the shoulder injury client. So looking at the symptoms that he has, he does have a slight bit of pain, but looking on first vision, like assessing the area, it doesn't seem that there's any contraindications. There's not a good amount of swelling and there's no bruising or anything, so it seems that I can go through with the process. So the first thing I'm going to do is just ensure that he's comfortable. Sitting in a comfortable position. Is your arm alright?
Yeah, it's fine.
Alright, can you like freely move it?
Yeah.
Okay, he seems to be comfortable, so, or even if he isn't comfortable, I can lay him down. So let's just lay down on your back. That's it. And I can start the treatment from here, making sure that I've got the arm securely covered with my right hand, and then I can start the treatment with my left hand. Stand either way, right side or left side, but this is probably the most suitable one. So I'm going to start with petrissage, which is kneading and weaving through the muscles, using quite a bit of force to get deep into the muscles and relieve any tension. It also relieves lactic acid, but due to the fact that this is a pre-event massage, what we're going to do is we're just going to ensure that the muscles are nice and flexible, nice and relaxed, and give away any tension. Also, in terms of psychological responses, it's going to also relax the patient, and if he's stressed or anxious, it's going to help him to calm down and get ready for his event. So what I'm going to do is, once again, using the right arm to keep it secure, I'm going to start with the left arm, making sure my legs are roughly shoulder width apart, one foot in front of the other. I'm not going to bend over too much because it's going to put strain onto my back and it's going to cause lower back pain. So I'm just going to stand nice and upright and lean into the massage. So I can even lay the arm down if it's nice. Is that comfortable for you?
Yeah, that's fine.
If it's comfortable, I can use both hands, get right under the tissue, and continue to do that for 2 or 3 minutes. The next one that I can do is I can use tap opening. So if you want to sit back up again, right, because that's quite a difficult position for me to adjust myself, I'm going to do the same thing, stand nice and upright. This is roughly my shoulder width, so it's a good height for me. I can literally, it's right in front of me, the shoulder, and then I can start to just relax the shoulder, and then it's a cupping and tapping motion to increase blood flow to the area. Also, it does the same effects. It helps relax the muscle, relieves any tension, and just gets that blood flow right to it. Also, what I forgot to mention is when we're using Petrosage and we're using these strokes and getting right deep into the muscle, we have to ensure that our strokes are going towards the heart, which increases the venous return and also helps with the blood flow towards the muscle. And then I'm going to continue that tap opening all around the working muscles, all the surrounding muscles as well, because through physiotherapy, he's going to get a lot of tension, a lot of muscle aching, so it's just going to relax and help relieve the muscles. And I'll continue that for 2 or 3 minutes. And also what I can do is, if there is, through the Petrosage, if it is quite a rough area, I can use lotion, I can use oil, depending on what's more suitable. I can use it just to get a little bit more grip on the muscle, and also to get deeper into there and use more. There's a more range of motion through my hand throughout the muscle. Yeah, that's it.